Do you ever feel confused by the myths around HRT or struggle to find a provider who really understands what you're going through? We've got you covered. Today, we're clearing up the facts about hormone replacement therapy and sharing holistic ways to manage menopause symptoms. If you're just starting your perimenopause journey, you'll learn about early signs to watch for and how to advocate for your health. Stay with us for a discussion that promises relief, clarity, and empowerment. Stay tuned as we dive into this episode of the Menowave Lounge, Hot Flashes and Cool Conversations.
Welcome to the Menowave Lounge, Hot Flashes and Cool Conversations. I'm Robin Duke, and this is my co-host, Marti Daly.
Hey there.
Hi. Our guest today will help us unravel the truths behind hormone replacement therapy, debunking the common myths, and sharing some crucial advice on advocating for your own health. If you're ever wondering about the real facts of HRT, or if you are seeking effective holistic approaches to managing menopause symptoms, you won't want to miss this episode. Stay tuned for a conversation that could change the way you think about menopause and your well-being. Before we dive into our episode today, we're excited to remind you about the Menopalooza Retreat in Sedona, Arizona, from November 4th to the 7th at the Wild Resort and Spa. Join us for an incredible experience with top-notch experts, new friendships, and the breathtaking beauty of Sedona. And here's some exciting news. We've launched a Marble of the Day contest. Sign up for the Menopalooza Retreat, listen to the podcast, and you could win a $250 spa gift certificate to the Wild Resort and Spa. Stay tuned for more details. You won't want to miss this.
Vanessa Weiland is the founder of Phases Clinic, a holistic menopausal wellness clinic based in Washington State. As a certified women's hormones therapy specialist, certified hypnotherapist, and board-certified adult gerontology nurse practitioner with over 10 years of experience, she is committed to providing personalized care for every woman going through the menopause transition. And Vanessa has some exciting new news to share with us. Why don't you tell us what it is?
So as of yesterday, I've added some new credentials to my name. I'm also a Menopause Society certified practitioner.
And so what does that mean for those of us who are not familiar with that certification?
So the Menopause Society is a medical society specifically around menopause cares. So they have board members that are all physicians or nurse practitioners, and they put out medical guidelines about the treatment of menopause, whether that's how can we treat with hormone therapy, how can we treat hot flashes without hormones, what are some options for low libido, things like that. They put out guidelines, and they have an exam just twice a year. And if you pass their exam, then you can become a certified practitioner like me.
I am so excited to hear that. My goodness, as we all know from talking through these podcasts and talking to our fellow care practitioners, it's very much needed. And so thank you so much for taking that extra step and going through that to support women going through menopause. We're so excited to talk to you today. Before we begin, why don't you share with us a little bit more, especially since you have taken this extra credential. How did you get interested in helping women going through menopause?
Yeah, so you mentioned that I've been an adult gerontology nurse practitioner for over 10 years now. And unfortunately, when I was in school to become an NP, I had basically no menopause training. And I'm a little bit embarrassed to say that I didn't get super curious about what I might have missed there. But I've been doing home health for quite a while. And so while I'm in the car, I'm often listening to medical podcasts. And one came on with a menopause specialist. And it completely blew my mind because not only did I learn almost nothing, what I did learn was really out of date. It's incorrect. And a lot of providers like me also got trained in some really out of date information. So that's probably part of what we're going to go over today. But since that time, I've probably studied menopause specific care for 100 or 200 hours. And so it's just really such a slap in the face that medical providers get maybe 45 minutes or an hour of menopause education when half of the population goes through this.
Wow, that is so amazing, because I'll tell you what, we have come so far in the last 5 to 10 years of understanding menopause and educating our doctors. And now we have certifications. Now we have women that specialize in menopause. And so that kind of information we're trying to get out there so that women that are going through that do have questions can now have more resources that can go to doctors that actually specialize in menopause. And so we are so glad that you are part of that group.
Thank you.
So before we get started, we always do a little menopause moment, a meno moment, we call it. And it's just a little lighthearted story of how menopause affects us every day. Marti, do you have one today?
I do, Robin. Poor Vanessa, she jumps onto this call with us as we do a little bit of prep before we actually hit record, and she gets on, and I am totally losing my mind. I was going to come on and talk about and share a funny story about how I decided to blow dry my hair with my big Vortex fan because I just can't deal with the heat from the hair dryer. But as I'm getting ready to log in, my Zoom is completely all messed up. Like, it is not showing any appointments. The background, if you've seen this, my background doesn't have my name on it. It's because my Zoom just completely freaked out. I don't know what happened, but we've got Robin, we've got Vanessa who have committed their time to this, and I want to be respectful. And so then there's that pressure on feeling like, oh, this isn't working. Technology is not my friend when I'm stressed out. And we keep it so cool and collected, and we're together. And that's how we're used to going, most of us, through our life, especially when we're doing something professional, something that's near and dear to our heart, especially for me when other people are involved. I always want to be the one that people can rely on. And man, just one little thing just goes wrong. And Marti had a moment. And I just want to thank these two beautiful ladies that are on with me for talking me through it and saying, hey, the sun will rise again. We got it all figured out, and it was wonderful. But it was just a reminder that a lot of us will have those moments, and there's a million different reasons of why it happens. And just understanding that, you know what, it's okay. It is okay. Give ourselves some grace. As I am getting older, I am learning how to give myself more grace through this and not freak out and not blame anything, but just say, hey, you know what? I need a moment to collect myself and bring myself back around. And of course, I have many tools in the toolbox that I can use. But yeah, it was just kind of a funny mental moment that even happens to us. How about you, Robin?
Well, yes, I totally can relate to that. I have meno moments every day. In fact, recently, and I think this has to do a little bit with the weather, because weather affects me. And I think it affects a lot of women, your moods. I mean, when the sun shines out, you're a lot more energy. You have a lot more, let's go do something. And then when it's kind of rainy, especially in the Northwest, we all know this very well, is that weather can really affect, it just kind of lowers our energy level. So yesterday I had somebody call. I have an RV that I'm selling, right? And I went, oh, great. Someone's going to come at 11 o'clock, right? I didn't even think about my schedule today, having, two podcasts that I'm doing, right? And in the middle of the night, and I swear to God, in the middle of the night, I'm laying there, I'm wide awake because I'm not sleeping. And I go, oh, holy, I have a podcast in the morning. What am I thinking? And it was just like one of those oh god moments. How am I going to do both of these? So I had to reschedule the other one, and so it's all working out. But it's just kind of like sometimes those minute moments, they just sneak up on us. And if I don't write things down and put them on my calendar and then check my calendar every day, they kind of sneak in and they get double booked. And that happened to me last week too. I had a meeting, totally didn't check my calendar, and it snuck up on me, and I was actually late for my own meeting. I can't believe it. But once again, giving yourself a lot of love and grace through it, and just realizing that these are the times that we're moving through, and it doesn't have to be the end of the world. It just means we find different ways to adapt through it. We're not the same as we were in our 30s or 40s or even in our 50s, but it's going to be okay. We're going to work through it. We're going to find solutions. I mean, so I have to write things down and remember to check my calendar. There's my minnow moment. Vanessa, can you share something with us? How do you experience your minnow moments, if you have any?
Yeah, I'm either having a very extended postpartum with my almost 3-year-old or a early perimenopause, because I definitely have my moments too. But I had a patient yesterday, it was at the end of the day, and I asked, what supplements do you take? And she gave me 3 supplements and I could only remember 2. And then right after that, I said, what's your medical history? And she gave me 3 things that her father had, and I could only remember 2. And she's like, what is up with this lady? So yeah.
Well, and I think that's such a good segue into the topic we wanted to start this conversation, because Vanessa is on the earlier ends. We know that perimenopause, and she knows better than she'll share, starts in our 30s. And I know that when I was 38, I mean, I had a 1-year-old and I had no idea what was happening. And my mother irritated me so much because like something would happen or I would feel weird. And she says, well, it's probably perimenopause. And I'm like, oh, shut up. Nuh-uh. I have a newborn. I am 38 years old. It's not that. But she was right, as she always was, about most things. And so I think it's a really good way to start this conversation. Vanessa, what is it that you're seeing with the younger women? Let's start off the conversation talking about what is some things that they need to know.
Well, first off, Marti, I'm really excited to hear that your mom mentioned menopause, because I think that's the position that a lot of us are in, is that our mothers don't warn us about it, our aunts don't warn us about it, our older sisters, our providers don't know anything about it, so they're certainly not bringing it up. And so a lot of us have this idea in our heads that menopause is hot flashes and your periods stop, and that's about it. And so some of these early symptoms of perimenopause can be very subtle. It's not obvious like that. Actually, a study came out this year showing that about 2/3 of women, they just say, I don't feel like myself. Like, what does that mean exactly? But that could mean anything, but that's just going into how subtle it is, these early changes.
What are some of the early changes that you have seen now that you know what menopause is and some of the symptoms? So what kind of early symptoms would somebody say in their 30s or 40s start seeing and noticing?
Yeah. So there's two major hormones that go down in the menopause transition. There's progesterone and estrogen, but actually the progesterone goes down earlier out of those two. So early on, you have a bit of a mismatch where you have actually more estrogen than the progesterone. And the progesterone, among other things, it thins the lining of the uterus. So when you have more estrogen than you do progesterone, you start getting heavier periods, maybe more frequent, more longer than they have been in the past. So here we are thinking menopause means your periods get spaced out and become an infrequent visitor, but actually early on it can be the opposite. And I think that really throws a lot of people off. And then progesterone also naturally can help calm us and help us with sleep. So when that starts to go down, that's some of the most common early symptoms I see are a ramp up in anxiety and trouble sleeping.
I wanted to ask you, because as I'm thinking back, I had a 1-year-old at that point, and you mentioned that you're 38 and you have a 3-year-old. Maybe we're having our postpartum changes and our hormones coming back, and then we throw in perimenopause. Do women who are like us, maybe have younger children or had given birth when we're in that perimenopause phase, does it really even matter whether it's because of the postpartum period or because of perimenopause? What can they do? Because I can imagine a lot of women, they're already stressed out. They're like, I've got a baby and all of this. Is there anything that special that they can do, or just to kind of ease their mind that things are shifting, whether it's postpartum or peri? Does that make
There's
sense?
especially early perimenopause, it is hormonally really similar to even postmenopause. So when you're pregnant, your estrogen levels are through the roof, higher than they'll ever be otherwise in your life. And when you have the baby, the estrogen levels crash and they're actually lower than normal. So that definitely is part of the issue with postpartum depression as well, is that big hormonal shift. And then for most women, while they're breastfeeding, the estrogen stays suppressed. So it is actually hormonally similar. But you're right. I mean, it's not just hormones. It's also the bad sleep can be a similar factor in both. Maybe your nutrition and your exercise are not what they ought to be because you have your young kid, or you're in the heights of your career, or COVID just happened. So yeah, these can all feed into one another and mimic one another. So it can be really muddy. I completely agree.
Because for me, I thought, well, that just means I'm old. And I was already getting some feelings about being an older mother, advanced maternal age, geriatric, which is what I didn't need to hear at that point. I feel like it's good for women at that age to realize, yes, all these things are going on. And maybe someone hasn't had a baby, recently, maybe they had their children younger, but they are starting to notice some changes, like you said, like their sleep is odd, or they're feeling more anxious, or heart palpitations, right? That we start I think a lot of women don't realize that they feel like their heart's doing weird stuff.
Yeah, that's a really common presenting symptom of menopause. And it can be the increase in anxiety, and it can also be when your estrogen goes down, that starts to cause more of the hot flashes and night sweats. And some people don't necessarily feel the flushing. They might only feel the heart racing because of the flushing, or they might only feel their body gets cold after the hot flash because it's kind of like you just lost all this heat in your body. And so you're actually lower temperature than normal. So some people don't feel it in the typical way, even though it's the same physiologic process.
I just want to like insert something here that just really just kind of popped in for me is, and this is part of our mindset around menopause and the word menopause, because I think back on this for myself. I would have never thought in my 30s, and I had my daughter late, my youngest daughter late, and I think it was like 36 or 7 when I had her. So I would have never thought that I would have been going menopause, was never something that entered into the conversation, especially at those ages. And the connotation of menopause, like you said, Marty, was like, that's for when you get old. And we never think of ourselves as getting old or ever going to be those ages. And so I would just really want to do like a double check on the mindset here, that we have to be open to understanding more about what our bodies are doing and how we can open up our mindset to look at it in a different way and not put the connotations of old around menopause or the word menopause or the symptoms, but actually understand it, embrace it, and that it is part of our natural cycle of life.
Yeah, I agree with you. I think that menopause has been a bit taboo, and I do think that's changing. But I've definitely noticed even among my friend group, a lot of women in their upper 30s or low 40s that they know what I'm doing. And some of them are really curious and ask me a lot of questions. And some of them like don't want to touch it with a 10-foot pole, probably because a lot of those associations. And also, I think, like Marty was saying, fertility is a big piece of this. And there might be people who don't feel like their family is complete. And that brings up a lot of emotions to start thinking about menopause. So I think that's totally reasonable. I don't push it on anybody. But I do agree that the more informed you are, because the alternative, if you want to pretend that perimenopause doesn't exist, is that you kind of think you're just going crazy when all of a sudden your anxiety's through the roof and you can't fall asleep. So I think there's a happy medium to find of embracing that change just so that you have that information to kind of feel armed with knowledge when you do start to have those changes. So you just don't feel like you're going crazy.
Yeah, I can see after talking and thinking about this, our hormones, whether we've had a later in life baby or not, but just all this weird stuff is going on. What have you seen that just like now that you know what you know is kind of like drives you nuts? What are you seeing these women are doing, or what advice are they getting that is just wrong at this stage?
I'm not usually annoyed by the women. It's the providers who,
Yeah.
like me, didn't get any education.
Yeah.
And so I hear from people that they're right, that they're sensing that something isn't quite right, and they're going to the person they think is the right person to talk to about it. They're either their primary care provider or their OBGYN. And because they weren't necessarily educated, and they also might not realize that palpitations are a common symptom and anxiety is a common symptom, they might say, oh, maybe it's just stress, or maybe you need to eat more vegetables, or, they basically get told that they're making it up too. So you already kind of have that suspicion in the back of your head, and then it gets reinforced by the person that you're really hoping to get support from. So I think that's really unfortunate. I do also think that that's changing. I think a lot of providers are recognizing now that they didn't get the education, and like me, are teaching themselves, but it's a slow wave of change.
Well, there definitely is a lot of bad advice versus good advice out there. And I know one of the questions that we see a lot in the Facebook group, Menopause Support Facebook group, is what is HRT or BHRT, and when should I start it?
Yeah.
Should I get on it? Should I not get on it? Some women have had bad experiences with it, maybe because they weren't diagnosed correctly or they didn't have the right combination of therapy. What are your thoughts about that, especially in the perimenopause arena?
Yeah, I mean, there's a couple of things to think about. First of all, it isn't always menopause, especially if it's someone like me coming in with abnormal periods and sudden issues with anxiety and trouble sleeping. We should think about the thyroid or anemia. There are other things we should be thinking about. We don't want to go the other direction and say everything is menopause. But a lot of providers, since they're not super comfortable with menopause hormone therapy or HRT, will either say, we can't do anything until you're in menopause, which is not true. Or they'll say, maybe your hormones are off, let's give oral contraceptives. And for a lot of women, actually, that does the trick, because the oral contraceptives is a much higher than normal level of estrogen. It's a synthetic estrogen. So it kind of steadies everything just because it's extremely high dose. But as I'm sure you've both heard, a lot of women don't like how they feel on that extremely high dose. So it's not the same thing. But on the flip side, menopause hormone therapy or HRT isn't a contraceptive. So if having a baby is totally off the table for you, then you still need another option on top of that to protect you from getting pregnant. The birth control pill is giving you such extreme high level of estrogen and progestin that it's shutting your whole cycle down. It's disrupting your natural process in your body that would turn on ovulation, make an egg come out. So for some women, they're just fine, and it's covering their hot flashes because it is estrogen replacement. But a lot of people don't like those super high levels. They feel crabby or moody or whatever else. They just don't feel good. So HRT or menopause hormone therapy is really just designed to be a little bump back into kind of a normal range for a 20-something or 30-something. So that's why it doesn't protect you from pregnancy, but usually you're not going to have some of those symptoms from the super high estrogen.
A question on that, because I have a lot of friends that are actually in my age group that are late 40s to even early 50s that have been on oral contraception all this time. A lot of them, they don't have periods at all. So I have many friends that are my age, like, I have no idea. I have no idea if I'm in menopause. Are they good to just stay on that, or is there a point where they need to come off of the oral contraceptives and then look at other options if they need to, or can they just stay on the birth control pills indefinitely?
Not indefinitely. We say around age 55.
Okay.
Unless there's some medical reason that you need to get off it sooner.
Okay.
And then you can immediately go right into HRT, or you can just go off it and see how you do. Some people might already be past the menopause transition by then and not really have hot flashes and other issues.
Well, there are a lot of women who, for a variety of reasons, and as we know from talking to some of the other practitioners, it's probably because they have good gut bacteria, they have a healthy lifestyle, but they don't have any negative symptoms of menopause. They don't have the hot flashes, anxiety, any of that. Do they need to go on HRT, or are they okay just staying natural and taking it as life comes? Because then there's a lot of argument on the other side of like, well, it protects your heart, it protects your brain function. So I can see a lot of women are like confused. They're like, well, why would I want to go on it? But I also want to protect myself.
Yeah, obviously you don't need to go on it, and none of the medical guidelines say everyone should be on this for prevention. We're not there yet. I think there's been a big movement lately talking about all those preventative aspects, and I think it's good because a lot of us have been thinking that HRT is bad for us for 20 years. So we're moving the dial back in a more neutral direction, but maybe almost too far where people start to feel bad if they're not on it, where really the science isn't quite there yet to say that we ought to do it for everybody. The one exception where we know that it's FDA approved for prevention is actually for bone loss. So if you're someone who has been slender your whole life, you have osteoporosis in your family, some other risk factor for osteoporosis, that's one time where hormone replacement is FDA approved as a prevention. But we're not there yet as far as heart health and brain health. I think the science there is really exciting, and I do think that there's quite a lot of data to support that. But I also would never tell someone that you have to be on hormone therapy if you feel like you don't want to. And none of the guidelines say that you ought to do that either.
And I think that's important to hear because when I joined the menopause support group, before I was a care provider, I was like in my late 40s and I wasn't on anything either. And I was like, I don't really have any symptoms. I don't really see the need. And I seriously saw so many people saying, no, you have to. You have to, because women died because they didn't have this. I'm like, no, people do. There's so much misinformation out there. And even in the group, which is so loving and so full of support from women holding one another up, I see some information or some advice shared that it's like that's not entirely accurate. Have you seen that as well?
Yeah, I've seen that. What the guidelines say now is if you have symptoms of menopause, hormone therapy, the benefits outweigh the risks, particularly if you are close to the menopause transition. So within 10 years of actually stopping periods. For me personally, both to help protect my bones and because I think the data is really exciting about preventing Alzheimer's and heart disease, I probably will pursue hormone therapy, assuming that I am a good candidate for it for other reasons and would intend to stay on it with prevention in mind. But like I say, the data isn't quite there to say that that is necessary or even guideline level evidence. I guess you could call it personal preference right now. But it is supported by data too. People aren't just saying that out of nowhere, but the research isn't robust enough to say we're certain about this. The cause and effect is clear because the people who choose to do hormone therapy might be a different group of women. So it's a little unclear now.
It's not a one size fits all kind of plan. It is a very personalized journey depending on your history, on what is working for you, where you are in your cycles. And there's so much that you can't just put it underneath one roof, so to speak. So if a woman says, I'm not ready for HRT, there's BHRT. And can you explain the difference between the two? Because one's more natural than the other.
Yeah. What's ironic is that the most natural one of all is HRT Premarin, which comes from horse urine. It's not processed. Everything else is made in a lab, but it's either something that looks very similar to what your body makes, or it's something that looks exactly like what your body makes. So that's what bioidentical or bioidentical is. It's made in a lab, but you would never know because the chemical structure is identical. So where all of this interest in bioidentical has come from is that there's been some studies in the past showing higher risk of breast cancer in people taking synthetic progestin. So actually, even the synthetic estrogen or Premarin, the horse urine estrogen, hasn't been shown to increase the risk of breast cancer if it's given alone. But the synthetic progestin does seem to cause a increased risk. And we're not talking a dramatic increase. It's about 5 more cases per 10,000 women per year. So I think a lot of people would maybe choose to take that risk if their symptoms are bad enough. But the body identical progesterone, although we don't have the same level of evidence, there hasn't been really any clues so far that it has that same increased risk of breast cancer as the synthetic progestin. There are some people that either lifestyle-wise, the synthetic is easiest because they don't want to take the pill or the pill bugs their stomach or whatever the case. And I would still say that even those synthetic ones have a great safety profile, but they've gotten a bad rap.
Right.
How do we know the difference between what is the synthetic one and the body identical?
So the body identical for estrogen is called estradiol. And for the progestin is called progesterone. So if you see something like medroxyprogesterone acetate or ethinyl estradiol or something like that, then those are the synthetic ones that are close but not exactly the same. So all birth control pills are synthetic. So if you see anything that's kind of the same names that you found in your oral birth control pills, then you know it's synthetic.
I can remember when my mom was going through it, and this conversation has been circling around, because our parents didn't talk to us. I had this conversation with my mom. My mom's 82. And I asked her, you were going through menopause at the time? And she said that she didn't realize that she was going through menopause, but she knew something was going on with her body. And she listened to a naturopathic, and that doctor explained to her what the difference between estrogen and progesterone was, and recommended that she started using the wild yam cream.
Mhm.
Okay. She went down to the health food store and she got the wild yam cream and she started using that. And that started helping her with her hot flashes, her sleeplessness, the mood swings. And she started telling me and my sister about it. And we were kind of like, oh, yeah, mom, because menopause, we didn't call it menopause. We called it the change of life. And she says, this will help you. And she sang the praises for that for a long time. And that's how she got through it. And I just thought that that was really interesting because a lot of the terms that we're learning now they're newer terms, and we need to understand what they are, and that we have so many more. Because then when I started going through my menopause in symptoms, then my doctor was talking to me about the synthetic. There wasn't the BHT back then, it was all HRT. And fortunately, I was very blessed. I had a lady doctor that did understand what menopause was and the symptoms are and how to balance that. And so she was able to actually create a formula that was specifically made for me. Now, having said all that, I just want to re-energize that there is more information. There's very good information out there, and we should be educating ourselves. I mean, even if it was like what my mom did, I mean, that was the best information that she could get at the time, and versus where I was at going through the same thing, and now where we are today. There's so much more amazing information out there, and so many different ways that we can use our different therapies. It's not just there's one, two, or three. You have many different ways of using these different therapies that, all the way from natural, all the way up to, the HRTs and the many different ways that they're put together.
It's interesting you say that, Robin, because as I was listening, I was remembering my mother had a completely different experience. But as you said, it was interesting that my mom talked to me about menopause. And this is part of the reason why. I can remember in the late 90s, gosh, it was probably like 96 or 97. And my mom was going through, and she's passed away, so I can't ask her this, but she went on some form of hormone replacement therapy. She was doing this because she was noticing symptoms. And then one day we're at the mall, just doing some shopping, and she just starts flooding blood down her pants, down into her shoes, onto the floor. And we have to run out of the mall. She bled all over my car. It was the scariest thing. Turns out it was a fibroid that she had developed. And so that terrified her. I don't remember the specifics, but she's like, no, I am stopping all of the hormone replacement therapy. And she didn't do anything else since then. And it never happened again, never had a problem with it again. She still had hot flashes and certainly a lot of anxiety and a lot of emotional stuff. But it was interesting because, Robin, your mother was like singing its praises, and my mother was like, oh, heck no. This was the most horrible thing.
Sounds really scary.
It was scary. It was scary. So then that leads me into another question for you, Vanessa. Then for women like my mother, take the HRT and they don't feel like it works for them. It just didn't work. And so they're like, yeah, I'm not going to do that, whether it's traumatic experience like my mom, or they're just like, I don't like the way I feel, or I'm just not noticing any difference. What do you recommend for them?
So there are some supplements that have pretty decent evidence. I mean, truthfully, the supplements that seem to work the best are the phytoestrogens. And so they're basically activating the same receptors. So if you feel like those work for you, then most likely there's a safe way to do hormone therapy. And then that's where you might need a specialist that can kind of weave with the punches if you do have side effects. Because certainly I've seen a lot of women in the menopause support group that say, oh, I tried HRT for 2 weeks and it gave me these symptoms and I just gave up. But there's so many things that we can do to adjust to try to find the happy medium where you don't have symptoms and you also have your menopause symptoms treated. And there's something you said, Robin, that I wanted to address quickly about the BHRT and having something compounded. And I think there's a lot of ethical and safe compounding pharmacies, but I just want to call out that you can get bioidentical hormone therapy, FDA approved patches or pills. So it doesn't have to be the compounded. And generally speaking, it's recommended to do the FDA approved ones just because they have a much more stringent process to get the FDA approval, and you can be more confident that batch to batch you're going to get the same levels of everything. That's the main complaint I get for people that have tried compounding is maybe it's great 1 month and the next month it's not working well, or it's working too well. They're having symptoms of too high of estrogen or testosterone. So I think for a lot of people, they can only find providers that offer compounding or pellets. And so, I recognize that there's kind of a vacuum of access out there, and maybe that's all you can get. But I just want to say, generally speaking, if you can find someone that will offer the FDA approved options, that's considered the safest place to start. But
Well, I think that just goes to show how far we've come in our knowledge base, because that was 10 years ago for me. And so at that time, that was cutting edge. And
yeah,
now we've come so much further than that with everything that's becoming more FDA approved and more consistent and better information on how it's going to help you. And we have more case studies now to have more approval success stories. We know we have a base now
yeah.
to be able to educate from. So we've talked a lot about HRT and that sort of thing, but what else should we be talking about for our audience today?
Mm-hmm. I mean, lifestyle wise, if you want to protect your bones and HRT isn't an option for you, then the biggest thing is weight bearing exercise, especially heavy weight. So probably actually getting into a gym that sends a signal to your bones to get thicker. And the earlier you start that, the better. Your diet and calcium is important, but it actually hasn't been shown in studies to reduce the risk of hip fracture later on. So really strength training, making sure you're getting enough protein in your diet, because protein is a big part of your bone structure too. As far as diet for menopause, so far none are really conclusively helping with menopause symptoms, but the most encouraging data I've seen is for a really heavy plant-based diet. And maybe that's partly the phytoestrogens you're getting and the fiber, or that it's less inflammatory. We don't know exactly, but that seems to help a little bit, at least with hot flashes. And then the Menopause Society, I think I mentioned, did come out with a guideline of all non-hormonal options to treat hot flashes. So they gave 5 things the stamp of approval for treating hot flashes, and those were certain SSRIs and SNRIs, so antidepressants, gabapentin, which is a nerve pain medication. It can help it with both sleep and hot flashes. Oxybutynin, which is a medicine we use for bladder incontinence and overactive bladder. So if someone has hot flashes and overactive bladder, that can be a nice choice. Cognitive behavior therapy, and fun one for us, some of us in the crowd, hypnotherapy or hypnosis.
Yes, my favorite.
Yes, I got trained in hypnotherapy because this guideline came out, and Marti knows hypnosis as well. So that's another option if you want something that's completely natural, not even a medication, that actually has guideline level evidence, level 1 evidence for effectiveness.
That's so awesome.
Well, that's really interesting. I mean, how does hypnotherapy help with hot flashes?
So there have been studies of hypnotherapy looking at brain changes, but not specifically for hot flashes. So it's hypothesized that part of it is that it's actually changing the center in your brain that's causing the hot flash, the hypothalamus, or it might simply be changing your body's reaction to the hot flash. When we have pain or when we have a hot flash or other physical symptoms, sometimes that's just only a fraction of the problem, and 95% of the problem is your reaction to it, and maybe you're catastrophizing of it and you're perseverating on it. So the hypnotherapy can really help break that cycle.
Marti, your thoughts on that?
Well, I think it's fascinating because it is the reaction to it. And I go back to, like you said, pain is telling us there's something that we need to pay attention to, right? And so what I always tell people is, if you're experiencing pain, take a moment. I mean, you don't want to power through, but if it's a pain you already know about, it's like, okay, well, I hurt my shoulder and it's an old injury and it just keeps coming back. There are ways that you can train your brain to interpret that sensation as something that is not as catastrophic or destructive or, frightening as that actual pain. And there's ways that you do that. I remember hearing the story of this young woman, and she lived in a rural area. This was a long time ago. Doctors, it really wasn't a thing necessarily to go to the doctor. A lot of home births. And she was off by herself at home, and she gave birth on the floor of her house. And when the doctor finally came and they're like, oh, it must have hurt, pain. And she goes, oh, is it supposed to hurt? Because she didn't know. And my epidural ran out when I had my first child. I didn't know it and I felt something, but I had thought my epidural was supposed to go. And so it wasn't pain. It was just more like discomfort. And they're like, oh, girl, you didn't have anything. It probably hurt. I'm like, no, I didn't know it. It's how we interpret it. And so imagine, well, I haven't specifically worked with hot flashes. I mean, you can do so much with hypnosis when you're in that state of reinterpreting what your sensation is and the meaning behind it. And because we're working with the imagination, it's unlimited. It's like whatever is going to work to get you to feel better and to get that sensation to change into something that is more manageable or more bearable, or even neutralize it altogether. So I imagine that's been your experience as well.
Just jumping off of that, there was a study that came out called the Swan study that was really wondering, how do different ethnicities experience menopause? So they looked at women all over the US, and they had women that were Asian descent, women that were African American, Caucasian, and that study showed that Asian American women had less hot flashes. But this was based on their report. So someone else did a very clever study in Hawaii where they took Asian descent women in Hawaii and white women in Hawaii and actually put a monitor on them and said, how many hot flashes are you having? And once again, the Asian women said, I'm having less. And then when they checked the monitors, it was the exact same. So are they literally not feeling it, or are they just kind of like forgetting about it or interpreting it differently? Not to say it's all in your head, but our brains do have a big impact on all of our bodily sensations, including hot flashes.
Go back to childbirth. Like in the story I just told, you hear, oh, it's the most painful thing. Oh my gosh, I'm squeezing a watermelon out through something the size of a star, all of that. But if you don't have that reference, if you don't expect that it's supposed to hurt, what you feel is not necessarily going to be pain. You're going to feel something, but you don't code it as pain. And same thing with a hot flash. If you're not expecting that, oh my God, it's the worst thing ever. Now I'm going to fall into that because I have bad, my hot flashes. I do it. I don't mind being a little bit dramatic, but I can see like with those women of like, well, gosh, we don't complain about it. Oh yeah, maybe that's, I feel a little hotter, but it could just be the sun on me. It could be this, or it's just like it's just part of life. It's just part of what I'm experiencing for whatever reason. And it's not causing that alarm. It's not causing that freak out. For me, it's not so much that the heat bothers me, it's the sweating. And I've always been a very heavy sweater person. Like I would go to PE in seventh grade and it'd be like early in the morning. And then I would just start sweating all day and it was embarrassing and people laugh at me and I get really red. And for me, it was just more the embarrassment of the physical reaction of just sweating through my clothes, being beat red. So I would say for me, when the hot flash comes, it's more that concern and the dealing with it, and more so than anything, the like actual discomfort from the hot flash itself, if that makes sense.
This is really interesting conversation that we're moving into, because not only does this conversation around how we train our minds to think about what's going on with our body, okay, and that can be through hypnotherapy. It can also be through visualization, mindset changing. I'm a mindset coach, so I definitely try to help women to turn around and view what their situation is in a different light. And so how we react to things really is big. And we're not trying to say what you're going through is not real or what you're feeling is not real, but we're just saying that this is an alternative method that if you choose to look into this area, that there are now studies and there's some amazing testimonies and people that can help you with adjusting your mindset to what you're going through in your menopause symptoms. So this is just another piece of the puzzle that women have. This is another tool in the toolbox that we have that can help us through our menopause symptoms in our journey.
As we're going along, talking about tools in our toolbox, and as we've discussed, we've come a long way with the information out there, and it's getting more and more exciting. There's still a lot of women out there that unfortunately are not finding the answers that they need. Vanessa, what do you recommend? What advice can you give for women on when they're on their search to finding a provider or finding help, who to look for? Do they need to like the certification that you have, or are there other good places to look, and how can they advocate for themselves?
Yeah, so the Menopause Society does have a provider database. So you can go in and just plug in your zip code and it will show you who around you is either a member of the Menopause Society or like me has passed that exam. So those are kind of the two levels. I think it still can be hit or miss. I have heard that people went to someone that passed that exam and still got the same kind of response or not much better, or they either weren't willing to do HRT or they're only willing to do pellets. But it's a place to start. And I think before you go in, if you have those concerns, you can certainly ask. And then there's Mary Claire Haver. She's a OBGYN. She recently wrote a book called The New Menopause, and it was one of the New York Times bestsellers. So that's why we know that this conversation is moving forward. And she actually has her own database of providers also. So I think it's on the Pause Life. And in order to get on that list, the patient has to be the one to nominate you. So that shows that the provider is giving care that the patients want. I don't know if she's doing further vetting with that as far as what type of hormone therapy they offer, but that's another option to find somebody. If specifically you're wanting testosterone therapy, that can be even harder to find. And that would be like a whole other topic to go down that road too far. But I just want to call out ISSWSH, ISSWSH, which is a society specifically of sexual health medicine. And a lot of those providers are more comfortable prescribing testosterone because it does have guideline evidence for libido specifically in women. So that might be a good resource to find someone that's willing to prescribe testosterone. And oftentimes they would also be comfortable with other hormone therapy. Yeah, it can be tricky. It can really be hit or miss. And so the more we can get away from this taboo and talk to each other about this and talk with your friends who have you found that listened to you and gave you treatment that you found helpful, the more that we can find people that are really knowledgeable in this field.
Yes, and I would really encourage you at this point to do your research, to reach out to Vanessa, to join the menopause support group. We have a lot of providers that are from all areas, and they are there to really support you, educate you, and give you the best advice or solutions or anything that you want to work with. Our podcasts are meant to give it good information from a variety of providers that are experts in their field. And we're here to help you, the audience, to really understand what their menopause journey is.
Clarification, the website for Menowave is menowave.org. And that's where you can find the providers that we have talked to that are part of Menowave, which is different from this podcast, which is the Menowave Lounge. But you can find us on Facebook and Spotify, and we'll talk about that in a moment.
And those links are all down below. And if you like our podcast, please subscribe and share this information with other women too.
I think that this information is percolating a little bit into the healthcare community. Healthcare providers are kind of catching wind of the fact that hormone therapy is really not so dangerous as we were potentially trained in school. So I think actually a lot more providers are open to prescribing it. They just haven't been trained in how to prescribe. So you could even print out the Menopause Society hormone therapy guideline, which came out in 2022. If you just Google what I just said, it'll pop up. It's a PDF open to anyone. And that goes through point by point. What's the safety? What are some recommendations? And you can just run it by your regular primary care provider, your OBGYN. Are they open to prescribing it and working with you? So, if you have a good provider that listens to you, and that would be great too, if more and more providers can learn how to do this. So there's even better access.
And speaking of working with providers, do you work with women just in Washington State, or tell us a little bit about how you work with women and who you work with? And if there's a woman that is in your area and wants to reach out to you, how they can reach you.
Mm-hmm. Yeah, right now I'm just licensed in Washington State for prescribing hormone therapy. So I have a clinic in North Bend, which is just east of Seattle. I have a clinic in Shoreline that I'm about to open, which is just north of Seattle. But then I do telehealth anywhere in Washington. So you could be in Walla Walla or Spokane or whatever, and I can prescribe hormone therapy. But I think that there's providers in every state that are really good at this. It can just be a trick of finding them, but I think that a lot of the providers in Menowave are also really knowledgeable and they'll know in their local area. They'll have heard from other clients who helped them out. So that's always a great resource.
It absolutely is.
I'm doing a Menopause 101 course for free. It's in the events in the Menopause support group, August 20th, 3 p.m. Pacific or 6 p.m. Eastern. I'll go into the data and studies a little bit more than I could here. So I hope that you'll join me there.
Absolutely. And we will put that link also into the show notes and description so that you can sign up for it. This has just been such wonderful information. Robin, you know what it's time for now?
Oh, yes, I do.
It is time for our Marble of the Day contest. Remember, if you signed up for the Menopalooza Retreat, you can participate and potentially win a $250 spa gift certificate to the Wild Resort and Spa. So today's marble, drum roll, that's probably not even going to pick up, is mindset. Near and dear to all three of our hearts. Mindset, MINDSET. Find the link in the show notes or the episode description, depending on where you're picking up this podcast. Enter the marble and you're in the drawing. If you missed any of the previous marbles, don't worry. You can go back and listen to previous podcasts to catch up. Each marble that you enter gives you another chance to win. Good luck. And we can't wait to see you in Sedona. As we wrap up, I just want to share as well that for those of you who don't know, I am holding on Wednesday nights what I call a mind massage session. It's going to be all through the summer and probably into the fall. These sessions are specially designed to help you manage menopause stress, anxiety, emotional roller coaster, guiding your mind and body towards deep relaxation and mental clarity. Each week, we're going to dive into essential topics like self-love, boosting confidence, and easing stress. It's all about equipping you with the tools to find peace and rejuvenation during this transformative time. If you're a member of the Menopause Support Group on Facebook, you can check out the events section for all the details and how to sign up. If you're not there, you can look in the show notes and you'll see a link to how to sign up and join. You can pick any one. They're on any Wednesday. It doesn't matter what date you click on. The calendar will allow you, if you can't meet the next one, but you want to participate, find a Wednesday that's going to work for you and sign up there, and it'll all come to the same place. You'll get a Zoom link. You'll get all the details. So check that out. The link is in the notes. Robin, anything you want to add?
Well, I just want to say this has been really powerful today. And I'm so thankful, Vanessa, that you came on and shared all this wonderful wealth of information. And I thank you for joining us at the Menowave Lounge. If you enjoyed our chat and want more insight conversation about menopause, be sure to subscribe to Spotify, Apple Podcasts, or YouTube. And don't forget to follow us on Facebook for extra tips and updates. Until next time, keep tuning in and keep those cool conversations going. This is the Menowave Lounge, hot flashes and cool conversations.
Wonderful. Thank you all. Thank you for joining us in the Menowave Lounge. If you'd like to connect with Marti, Robin, our guests, or any of our expert Menowave care providers for personalized advice and support, head on over to our website at menowave.org and fill out an assessment that will match you with a provider who knows just how to help. Remember, you don't have to face menopause alone. Our team is here to provide the guidance and care you deserve. So, take that step towards reclaiming your well-being and connect with a Menowave care provider today. Thank you again for tuning in, and we'll catch you on the next episode of the Menowave Lounge, Hot Flashes and Cool Conversations.